Hello again, we are with Dr. Murat, and taking advantage that he is today with us, we would like to ask about one of the main surgeries we perform, that is the sleeve gastrectomy. Most of the patients wonder if they are good patients for this operation or not.
Yes, definitely sleeve gastrectomy is relatively younger operation than gastric bypass, but regarding to the numbers of the cases, it's number one operation in all over the world at the moment. The reason is sleeve gastrectomy is very safe, very fast and very straightforward operation. We remove nearly 80% of stomach, and we change the shape of and volume of stomach. We don't change digestive system route, and we don't make any anastomosis or connections with the small bowels. So we prefer this operation in morbidly obese patients, of course. And secondly, the patients who has not have very serious metabolic problems like diabetes, high blood pressure, or etc., or supermorbid obese patients. Who is the best candidate? Eating too much food, solid food especially, doesn't have any serious metabolic problems, and volume eaters, the best candidates. But in some circumstances, we cannot advise gastric sleeve operation. One of them, if a patient has severe reflux esophagitis and hiatal hernia, gastric sleeve is nearly contraindicated these patients. Because of the nature of operation, gastric sleeve is a high pressure system, and after this operation, some of the patients have reflux problems. If a patient has already severe reflux or hiatal hernia, we don't prefer to perform gastric sleeve. Instead of gastric bypass would be better. And the second thing, if a patient is sweet eater and or she or he is not a volume eater but has too much metabolic problems like diabetes, sometimes we prefer to perform gastric bypass instead of sleeve. Otherwise, gastric sleeve is a good operation, and as a primary operation, it's definitely very reliable operation. And at the same time, it's convertible operation. If a patient has sleeve, and after years, if the patient has weight regain or diabetes occur, we can easily add an anastomosis connection, and we can convert the operation to the upper operations, bypass, bipartition, or SAVI.
Okay, that's a very good explanation. Thank you, doctor, so much. We hope it's very clear for our patients too.
Thank you.